Hi everybody, this is Dr. Flasky of Flasky Chiropractic and Acupuncture, and today we're going to continue our series on the Diagnostic Musculoskeletal Ultrasound that we've been doing in the office now for a while. I wanted to talk about one of the more common complaints that I see in my office, and that's carpal tunnel syndrome. Now, that is a condition where the carpals, which are the wrist bones, they form a little arch and there's a ligament that goes across it, and through that is our carpal tunnel. We have a bunch of tendons that go through it, and then we have the median nerve. The median nerve is what gets compressed with carpal tunnel syndrome, and that happens if we overuse it or we injure it and things get swollen and tight in there, and it causes tingling, most specifically to the pad of the thumb, the pointer finger, and the middle finger. It doesn't tend to do the rest of the hand. So if you've got that set of symptoms, or if you've got weakness of grip, or like picking up a coffee cup, those are pretty common complaints with carpal tunnel syndrome. The way that we measure this is something called a wrist to forearm ratio, and that is simply an image of the wrist here and an image of the wrist here, about 12 centimeters down from the crease, and then we measure the ratio of how thick this one is compared to this one, and if we go over 1.4 to 1, we call that carpal tunnel syndrome. The gold standard for diagnosis of carpal tunnel syndrome is actually something called a nerve conduction velocity test, and that is where a specialist will place little needles into the area of the nerve, run electricity through it, and then they measure the speed of how fast that nerve runs, and if it's too slow, well then that is also carpal tunnel syndrome. But the diagnostic ultrasound there's no pain with it, and it gives us some pretty good screening results to decide if we can treat that conservatively or if we need to make a referral out to a specialist. So what we're going to do now is we're going to run a little video of what I'm looking for when I'm measuring this nerve and the size of the nerve, and you'll get an idea of how that whole thing works. And so we'll just go to that video now. Okay everybody, so here is the ultrasound screen. I'm actually going to be doing this on my own wrist. I do actually have carpal tunnel syndrome myself, but I have been managing it pretty well over the years with some conservative measures. Right now you just see the blank screen. It's not on my wrist yet, but it's going to be right here. Okay, so I just put a little bit of ultrasound gel on there, and I need to move this a little bit shallower. All right, so, oh, thank you, computer. All right, so the first thing we do is, it's on my left wrist right now, and it's a little hard to see, obviously, because this is kind of a bunch of blobs, but what I've got right there, and I'm just gonna save that image, and we back it up just a little bit. That thing right there is my median nerve. And so then what we do is we measure it with a little measuring tool. And this is not going to be exact. The video is kind of hard to do. So right there I see I have an area of 16.53. And then we're going to save that image, and then I'm going to start it up again, and we're going to find that nerve again. It's right there. It's the black one kind of in the middle, a little gray, and then we're just going to move the probe down about 12 centimeters, and then I'm going to find the nerve again, and I'll show you where that is. Once I find it, and this one is even a little harder to see. Takes a while to figure out what you're looking at, but once we get it, then we can see it right here. And we just measure that up, measure the circle around there, and then we're going to save that. And you can see that the area on that, maybe you can't see it or not, but that area says 10.48. And so just roughly doing the math in my head, 16 on the wrist and 10.5 on the forearm. It's going to give me just a little bit over a wrist forearm ratio over 1.4. And so this would be just some very mild carpal tunnel syndrome. And I don't have any symptoms right now with tingling in my fingers, but if that gets a little bit bigger on that ratio, I would start to have that tingling once again. So that is all there is to it for using a diagnostic ultrasound to determine whether or not you have carpal tunnel syndrome. This is one I would not send out for nerve conduction tests because it's just not bad enough.